Hi, my name is Lindsay Lawrence and I have the medial collateral ligament taping. First, you can take some tough skin and spray the involved leg. For patient positioning, you want your athlete standing on a treatment table or on a bench with the involved leg in slight flexion with a heel prop underneath. First, what you want to do is you want to place some pre-wrap on the mid-thigh as a kind of a base, and then you want to put some pre-wrap mid-calf as another base. We're going to be using Elasticon or 3-inch heavy weight elastic tape. We're going to start around the anterior portion. We're just going to do some anchors with the Elasticon. It's really hard to cut, so you can't rip it with your hands. Got to use scissors. We have the Elasticon anchors. First, I'm going to start at the medial, or the anterior portion of the mid-thigh. I'm going to go around. I'm going to go across the medial aspect of the knee and come down behind the calf. Okay. You want to pull with some slight tension because this taping is kind of in place of a brace. If an athlete forgets their MCL brace, or if they just have some MCL weakness. But so some slight tension on that, and then I'm going to start posterior mid-thigh for the second strip, pulling across the front, coming across the medial knee again applying some tension, and then I'm going to cut an end at the front of the shin here. Usually 1X shape will suffice. If the athlete feels like this isn't strong enough, you can do up to 2 or 3 more X's, but that should suffice typically, and then we're going to close with some power flex. And that's it.
This taping technique is used in the treatment of medial collateral ligament sprains to provide mild to moderate support and protection against valgus forces at the knee. This taping method can be used in substitution for a brace if an athlete forgets their brace at home. Typically only grade 1 MCL sprains.